Hello, my name is Dr. Christina Wells. I am a physician board certified in both family and lifestyle medicine. And today I have the privilege of talking to you on a subject that is very near and dear to my heart and gets me very excited anytime I talk about it. And hopefully, after this presentation, you will be excited as well and feel more comfortable being involved in community engagement. Community engagement is something that we all should be spending more time employed in. And hopefully today you will learn some tips that will help you to be able to get more engaged within your community. So what is community engagement? According to the World Health Organization, community engagement is a process of developing relationships that enable stakeholders to work together to address health-related issues and promote well-being to achieve positive health impact and outcomes. I really look at community engagement as an opportunity for me to learn more about the environments that my patients are interacting with. And as I learn more about those environments, I'm better able to understand the things that impact their health. And then that will help me in my treatment plan as I am counseling my patients. So for me, it's really important for me to understand the communities in which my patients are engaging in, and then for me, myself, to be able to be more community engaged so that I can help my patients to thrive and have better health outcomes. So why is community engagement important? Community engagement builds trust, improves communication, improves health outcomes, and enlists new resources and allies. I think about my experiences within community and being involved in different aspects of the community, and it has allowed me to do all of these things: build trust with partnerships within those who are within the community. It also has helped me to improve communication with my patients because I'm better able to understand the communities that they're engaging with. And then because I understand that and the impact that those communities have on my patients, it really helps me to be able to tailor the treatment plans that I give them, and that helps to improve outcomes. And then it helps me to understand and build new partnerships and allies within the community that can also assist me in caring for my patients. So now let's think about who or what is the community. I know many times we may think about the community as the local geographical area where our patients live, but community can mean much more than that. Community can be the environment in which our patients work, where they identify, or where they connect with others, such as faith-based organizations that they may be engaging with on a regular basis. Or it might be the local YMCA where they go to their regular exercise class. Community could be the local barber shop or the local beauty shop where they go in on a regular basis and again have their sense of community. So I think that we have to think about community as outside of just the local geographical area, but think of it as any type of situation or environment where our patients are engaging on a regular basis. And it's important to think about this because these environments will have an impact on our patients and their health. So now that you know what community engagement is and why it's important and what is defined as community, now you can look at how do I get engaged within my community? What are the steps that I should take to help me to come up with a community engagement project? I'm going to outline some simple steps that can help you to be successful as you think about community engagement. Step one in that process is to conduct a needs assessment or identify a need in your community or the community that you plan to target. Conducting a needs assessment is a process of gathering more information about the local community you are focused on. It should tell you all about the strengths and resources available in that community. It should give you a more accurate picture of the issue, the local policies that impact the issue, and the environment. When I think about the different initiatives that I've done within the community, it's always started with this step of the needs assessment. I've always looked and said, what can I do within this community that I want to target? What are the needs within this community? And how can I best approach those needs? And so the first step is conducting that needs assessment and identifying what are the needs within the targeted community that you plan to engage with. After you have identified the targeted community, then seeing the needs within that community and decided on what you might want to address within the community, you want to come up with a community outreach plan. And that community outreach plan is where you document your approach to sharing information with the local community you are targeting. And I'm going to, in the next slide, discuss steps you can take to develop and outline your outreach plan. Conducting the community needs assessment is an integral part of the community outreach plan. As a part of conducting that community needs assessment, you really need to think about what are the systems in place within the community and how they impact that community and how they're going to impact the plan that you are going to devise. So you want to think about the cultural systems, the political and policy systems, the economic systems, and prosperity. When I was thinking about doing a health fair in my targeted community several years ago, I had to think about all of these factors. I had to think about what would be the most beneficial services for me to bring to this community based on the community needs. And so conducting that community needs assessment is so very important. We definitely don't want to bring services to a community that are already saturated within that community. We want to think about the needs of the community and really try to address those in the best way possible. During your community needs assessment, you will likely identify many unmet needs in the targeted community, but you will probably not have the time or resources to address all of those unmet needs. So in step 2, you're going to identify and know your issue. You're going to pick or prioritize your target. So this is where you're going to take all of those needs that you have identified from your community assessment, and you're going to decide based on your resources, your time, maybe other partnerships, and think about what is that 1 or 2 issues that you are going to address in your community engagement intervention. Now that you have identified a target community and then done a community needs assessment to identify unmet needs within that targeted community, And from that community needs assessment, identified one or two needs that you want to address, you want to move on to the next step, which is setting goals. And your goals should be SMART. They should be specific, measurable, achievable, relevant, and time bound. Specific goals are thinking about what needs to be accomplished and who will be responsible for it. Also, what steps need to be taken to achieve the goal. Measurable is those trackable benchmarks. Achievable means setting realistic goals. Relevant is making sure that the purpose of the goal is connected to the target audience. And time-bound is thinking about the time-related parameters of the goal. So let me give you an example of a SMART goal. A SMART goal would be specific in saying that you're going to do a health talk in a local YMCA on mental health. You're going to bring in some licensed clinical social workers who will help assist with the health talk. The purpose of the health talk will be to increase awareness of mental health and decrease stigma. So that would be a specific goal. Then when you think about the measurable part of that goal, you can measure whether that goal was achieved by creating a questionnaire that you give to your participants before and after the health talk. And this questionnaire could assess whether or not you were able to increase awareness of mental health and decrease stigma. Achievable can think about those realistic goals. You're going to think about the time you have to do the goal, to do the talk, the location where the talk will be given, and also whether or not you're going to be able to get assistance from the social workers to help you to deliver the session. Relevant is thinking about, is this an unmet need in my targeted audience, which you've already really identified in your previous steps. So you know that this talk is going to be important to the targeted audience. And then time-bound is those time-related parameters. So you may say that I'm going to give this talk on mental health for 1 hour on a Saturday for the next 3 months. And so these are ways that you can create these SMART goals. And it's important that you go through the steps of having SMART goals because it will help you to really outline where you want to go with your community engagement. So you have your goals. Now you want to create your list of stakeholders. The primary stakeholder in your entire program is going to be the target audience. It's going to be the people within the community for whom you want to make a difference. Then you're going to be thinking about other stakeholders, people who are deeply associated with the community and have a say in how things are run. Or think people who are also a part of initiating community outreach. Is there a community leader? Is there someone who is already engaged in the community? Is there a local political member that can help you? These are all examples of stakeholders whom you should consider. Stakeholders are people who can have a direct or indirect impact on the community you are looking to target. They are deeply invested in the community and already have a relationship with them. A few years ago, I was working with students at the university where I teach, and we decided that we wanted to do a community outreach program. And so we thought that we were going to go into the community and we were going to offer blood pressure screenings and blood glucose screenings. So one of the things that we did was think about our stakeholders. So our stakeholders were the people within the community. But we also wanted to look at others within the community who could assist us as potential stakeholders. So we went to a local barbershop And we talked to that barbershop owner. And we talked about the program that we wanted to bring to the community and how we could partner with the barbershop. And the barbershop owner was ecstatic. He allowed us to set up our table inside and outside of the barbershop and really was able to give us some insight as to the types of people within that community and some of the ailments, again, that they were facing. And so he also added to our community needs assessment. So it's important that we think about those stakeholders and connecting with relevant stakeholders in the targeted community that we're looking to engage with. So you've come up with your SMART goals and you have engaged your stakeholders, and now you want to develop a strategy. And you want to engage your stakeholders in the development of your strategies moving forward. One of the things you can do as you think about how to develop a strategy is to develop something called a logic model. And a logic model will help you to organize your strategic plan. Here you can see a logic model that I developed as I was thinking about a community outreach program. The first thing I thought about were inputs. What are we investing in this community outreach program? So we were investing volunteers, time, facilitators, funding, educational materials, and marketing. And then our outputs were, who were we going to be putting those outputs to? So what were we going to do and who were we going to do it to? And so we were going to have activities that included conducting workshops and meetings, small groups, health fairs, cooking classes, exercise classes, smoking cessation classes, training and counseling. And so this is a larger plan that was going to go on for some time. And then we thought about the participation, who we were going to do this to. And those our participants were going to be community and church members. Then lastly, we thought about our outcomes or the impact. And these were the incremental events or changes that were going to occur as a result of the outputs. And so as a result of the outputs, we were going to, in the short term, have increased awareness around chronic diseases, going to have increased awareness of mental health, and decreased stigma associated with mental illness. In the long run, we were going to have a greater ability to be able to improve management of chronic diseases, improve individual mental health, and also have improved family relationships in the long run and stronger communities. And so here you can see with this logic model, we went from our inputs to our outputs to our outcomes to help us to devise a strategic plan. So we have our goals, we have our stakeholders, we've come up with our strategic plan. We know what we're going to put in, we know who we're going to put it into, and then we have our expected outcomes. Now we have to do step number 6, which is build a coalition and start engaging with key decision makers. And this could be in the form of things like having town halls, where you can have a town hall in the clinic, or you can do it in a local community center. You can have informational meetings. And as a part of this step, what you want to do is to be able to get buy-in. You want to recruit volunteers, form committees, and partner with other community organizations. So this is a step beyond engaging your stakeholders and really continuing building that coalition and continuing to build and engage with key decision makers. Now you want to craft and refine the message. And this is so very important. This should build upon all of the information that you have gathered regarding the targeted audience that you are going to engage in, because you want to make sure that your message is going to reach them. You want to make sure that it's going to be a message that the community can relate to. It's going to be in the language of the community. And so it must be relational and relatable. And so you want to craft and refine that message in a way that is going to really spark the interest of the targeted audience. In addition to crafting that message, you want to tailor it across the channels that are going to reach your targeted audience. And so this is the outreach and the market. And you want to be thinking about the targeted audience and what they're going to engage with on a regular basis in terms of media. So you have to think about your audience. Are they more of an audience that is going to be better suited to have flyers or to have direct mail or to have phone calls or texts or emails or traditional media like television? Or are they going to be an audience where you're going to have to think about having social media messages? Do you need to have Facebook messages or Instagram messages or LinkedIn messages or Twitter messages? And so you want to think about the audience that you're trying to target. You have crafted your message, and now you have to think about how you're going to disseminate that message and what is going to be the best channel to disseminate that message based on the demographics of the targeted audience. And here you may think about that there may be multiple channels that you want to use. So you may use multiple ways to contact and address and reach your targeted audience. The last but critical step in your community engagement outreach is to measure your impact or to evaluate your program. You want to think about what went well and what didn't go so well and what lessons you learned. It's important during this step to get feedback from your stakeholders. Those would be the participants in the program, as well as other stakeholders who were involved in the process of your community engagement or outreach. And so this step is very important because it's going to be able to drive your strategies for future programs. So you don't want to skip this step. It's important that after every outreach or engagement program that you have an evaluation and a debrief. And so I hope that this was very beneficial to you as you think about the importance of community engagement. I hope that you can utilize these steps to really help you to form a plan forward for how you're going to go about engaging in your community. I hope that this will outline it in a way where thinking about community engagement will be something that you'll be more comfortable with and have some simple steps that you can undertake to be able to allow you to be more fully engaged in a community outreach initiative. I hope that this was great for you, and thank you for joining us today.